talking about the disease itself, there's a lot of sort of, I wouldn't say controversy, but I would say conversations about sort of the roots and the understanding of what Alzheimer's disease is. So, how has our understanding of the disease improved over the past couple of decades? And sort of which areas have we made the most strides or the most success in so far?
The pathology of Alzheimer's disease is reasonably well understood. It's related to the accumulation of amyloid beta in amyloid plaques, neuritic plaques, as well as the accumulation of abnormally phosphorylated tau protein that forms neurofibrillary tangles. The amyloid beta protein also accumulates in cerebral blood vessels and something called cerebral amyloid angiopathy, vascular amyloid, and that also is an important part of the pathology of Alzheimer's disease. For the amyloid beta protein, as well as for the abnormally phosphorylated tau protein, it's thought that the soluble oligomeric species of A beta and tau are the most toxic and most responsible for driving a neuronal dysfunction and death. And that's a major therapeutic target for many of the developing approaches. It's also become abundantly clear that the pathogenesis of Alzheimer's disease, despite having all those common lesions, the amyloid plaques, the congophilic amyloid angiopathy, and the neurofibrillary tangles, is heterogeneous in its underlying pathogenesis. So in the very rare early onset forms of Alzheimer's disease that are associated with particular mutations and genes like presenilin 1 and 2 in the amyloid precursor protein, which are less than 1% of the total. There's the overproduction of amyloid beta that's driving the process because of the mutations in those particular genes. But in the much more common late onset forms of Alzheimer's disease, over 30 different genes have been identified in various gene-wide association studies, and they're in diverse pathways and cholesterol metabolism, immune function, endosomal, lysosomal function, synaptic function. The drivers of the disease are diverse. Therefore, the therapeutic approaches that might be amenable also have to be diverse. It used to be that most of the preclinical and indeed the clinical trials were very much amyloid centric. So they were pretty much all targeting the A beta on the plaque side of things. But that really, in the last few years, isn't true. And diverse targets are being assessed. And I think these approaches are not mutually exclusive. They can be sort of honed to particular subsets of Alzheimer's disease with their specific underlying pathogenesis. So we can be much more focused in our approach, given the type of Alzheimer's disease and the stage that a particular patient is in, hopefully in the future, when we'll have possibly a whole set, an armamentarium of different approaches that address various pathogenic pathways of Alzheimer's disease. So, while the basic lesions and what's happening in these lesions is well understood, but what's driving the ultimate emergence of this pathology, I think we're understanding that it's very complex. And the approaches that are being assessed are helping to address that sort of complexity.